Hello, and welcome to our monthly digital BC live stream. For those of us joining for the first time, welcome. We host these calls monthly, and they cover a wide range of topics relevant to the BC digital community. So my name is Jen Lambert, and I'm the Chief Digital Officer for the province. My team's role is to help our colleagues across government provide better services to people in British Columbia by supporting all of us to adopt modern tools and ways of working. So I'll be your host for today's session. I have brown hair that's a bit wavy today, light-skinned with hazel eyes, and I'm wearing a blue blazer. So I'll start us off in a good way by acknowledging that I'm joining you from the beautiful Saanich, BC, where I am grateful to work and play on the traditional and unceded territories of the Lekwungen and Wasanich peoples, whose historical relationship with the land continues to this day. And as we get closer to May 11th, Moose Hide Campaign Day, I'm particularly grateful to this Indigenous-led movement that calls us all to stand up against violence towards women and girls, which is something that some of my own extended family has experienced. So a bit of housekeeping before we start. The session is recorded and it's shared with folks inside of government as well as open to the world. You can turn on live captions at the top of your screen, and you can see that we use MS Teams Live. So please do ask questions, upvote those you like, and we will get those into the conversation. We will also follow up with a podcast later in the month with any questions that we don't get to. We often get more questions than we can fit into the session. So at the end of this session, you're also going to get a survey. We do read it and use it to drive our topics and adjust our approach on a monthly basis. So today I'm excited that we have some great guests. We're going to be talking about solving problems together, creating connected services so that we can deliver better service experiences for people in British Columbia. And that is one of the key missions of BC's new digital plan. So my guests today are Pam Smith, Executive Director for the Ministry of Health with Digital Health Strategic Initiatives, and Kaine Sparks, Executive Director of BC Registry Services. Both Pam and Kaine have led initiatives that connect services together to create better experiences for people. And they're going to share their stories about working across organizational boundaries to deliver connected services. They're going to talk about what was challenging about that and what made a difference. So before we get into our questions, I'll start off with an example from my own life of an experience with government services that could have benefited from being a bit more connected. So last summer, I had to get my daughter's passport renewed. We had a Christmas vacation booked with our extended family in Mexico. And I was worried that 6 months wouldn't be enough lead time because I've been reading the news and hearing about other folks who had to cancel their vacations. So one day in the summer, I was on my phone at 7 a.m. so I could snag an appointment at Service Canada. They came up, during the day for weeks out. And 7 weeks later, I had an appointment. On that day, I took time off work. I printed out the form and I drove out to Colwood. I did get stuck on the highway. That was my fault, not the government's fault, and arrived late for my appointment, and still I had to wait. When I finally did see a clerk, she told me to go home and make an appointment with the passport office downtown because I couldn't get it by December if I gave my application to her. And that's even though I had checked the website and followed their instructions to go to Service Canada if my travel wasn't within 30 days. So I did end up making another appointment at the passport office, which was more than 30 days out before my travel, and got my passport in time, or my daughter's passport. But the whole experience was anything but easy. There were many opportunities to better connect the information on the website to how the service actually works, and to connect other government services like identity verification that would have helped me at least get partway through the process at home when I had the time and wasn't going to get stuck on the highway. So now that you've heard my story of inconvenience, I think it's a great time to hear from Pam and Kaine about how they've worked to connect services together that are much more important than me getting to go on vacation. Okay, so let's start with Pam. Could you describe how you worked with partners to deliver Health Gateway, which connects information from many different parts of the health sector so we can each get our own health information at our fingertips?
course. Thank you, Jen. So we started not only with wanting to create a connected service, but also a connected experience. So we reached out to our government partners and the digital lab as an example to say, this is the problem space we're trying to solve for. People don't have access to their information. It's hard, it's manual. You have to do a freedom of information request. You basically have to ask permission, which doesn't make any sense. Like, how do we meet people where they're at in their healthcare need? And so it was amazing to work with partners such as the lab, government digital experience, government comms, the security folks, the privacy folks, just all the partners across government, and listen to their ideas, what they had done in similar spaces, processes, policies, tools, tech that we could leverage. And that was the key. We didn't have to start from scratch. It was, what can we already start with? What can we reuse that we already have within government, and get the ball rolling? So that was really the key, was leveraging those existing government public sector partnerships to say, how can we have an impact?
That's great. And how did you work with other parts of the health sector to get the data in so that it can be connected together?
So that is still ongoing, full transparency. It hasn't been easy. Data governance and information islands is one of our biggest challenges within healthcare, and that's reflective of our landscape as well. But we worked with provincial data sets to start with, so the ones that I'm going to say are under the auspices of the ministry, because those are our own policies and things we know in our own backyard, and we can kind of challenge maybe some of the historical thinking there a bit more with some more flexibility. But it also gave us a way to have those conversations with our partners and say, this is what we're trying to do and why we're trying to do it. It's about providing healthcare to the public, the people of BC, and healthcare is a service that is provincial, not by a particular geographic reason. So it was really trying to bring folks along and say, how can we help bring you along, recognize the great work you do, but fold it into this as well. And we recognize that everyone's in a bit of a different time and space, which is also why we started with provincial data sets. It's like, if we can do it there, prove it out, we can bring our partners along to show them that what is possible and how they'll be able to contribute and participate in that space.
Yeah, that makes a lot of sense. Make sure that we're doing it ourselves first,
Yeah.
And showing what's possible. That's great. Okay, Kaine. So you've really modernized the experience for companies that are doing business in BC. How did you work with your partners to make sure that the information online and information in person or on the phone is all connected together?
Thanks, Genevieve. And kind of as Pam alluded to, it's always going to be a work in progress in this space, but we're definitely taking big strides. So today I just wanted to focus on, we had lots of options, lots of partners, because BC Registry, Service BC is like the birth of businesses. So we have lots of connections in that place. So I was going to just start with digital access to our data, like so an API, application programming interface, and how those partners, which include ministries like social development and poverty reduction that provide services to their user groups, and other ministries, banks, all of these kind of partners that we work with to create our service. Some of the initial pieces, we knew that we needed to start this work very early. So any modernization in this space, we started at the drawing board. So we had Small Business BC, Lab, Chamber of Commerce, Ministry of Social Development at the table to have these conversations and what we're going to do at least 12 months in advance of these modernized services and the way they were going to use them. So just a lot of lead time for people to become in that space. And then also, every 2 weeks we were showing what we were doing, and those people were invited to the party essentially, so they can have a say and give feedback from that space as well. So some of the challenges in there, obviously within this new realm of digital access, they're screen scraping, which is where companies will come grab your data and just do their own thing, and you have no idea if they're using it or not, and that included ministries. For that. So this API strategy, which is the access to data strategy, allows us to know our client too, which was a big change. So we know who's coming at the door and knocking there too.
That's great. So a lot of commonalities I'm hearing in terms of bringing folks along the journey. We're working with them, making sure that they know what's happening at every stage and can contribute. That's great. Okay, Kaine, another question for you. What have you seen as the impact of connected services for business? So what kind of feedback did you get from businesses before you started the modernization, and what was the experience after?
Thanks, Genevieve. Yeah, so we undergo like Agile Scrum methodology, which is coming more prevalent, obviously, across government, which is great. And that part of that is service design or user research, which is kind of what you're alluding to there. So in talking with our businesses, we co-created, which means we sat down with them and actually went through what they expect and built wireframes or ways of working to create a business with the users in that space, and then that continues on. So we next phase within a month, you're talking to the same users, you're showing them the same thing, and then you're building new features to increase that. So the methods that previously were undertaken in BC registries when you would create a business, in some aspects, we've gone from something that took 4 weeks to 10 minutes. And the feedback we get in that obviously is very positive for people's time and spent, which is very valuable to citizens in that space.
Great. Pam, maybe same question for you. What have you seen as the impact of connected services for people looking for their healthcare information?
I think that what we've heard, and this is great because we had a lot of direct feedback from the public and their families and our clinician community as well, is that it makes people feel more empowered and engaged in their healthcare in that moment. And from a clinical perspective, where there's comfort level in this type of modernization, because it is change from how documentation is done, change from how maybe the interaction was previously. It allows the individuals in that moment to really focus on the immediate need and not be guessing about history, your medication history, or a previous lab test, or whatever it might be. And so they can have a more meaningful full dialogue. So, I think that's the key. And as I mentioned, prior to this, you were doing a freedom of information request or a request out to the health authority for your information. That could take days, weeks, or months and would typically be heavily redacted. Yet it's your information. So this is really turning that equation around to saying, this is now you being able to access your information on your own time without needing to seek permission. We still have a long way to go still and a lot more to do, but it's been really exciting, the feedback we've gotten and what we can still do based on that feedback.
That's great. Yeah, I think that's important as well. It's sort of not a one and done, right? Like, people will have more questions as they interact more with it and as more data is added to it as well. It's great. So I know when we were talking about this earlier, you had talked about the role of governance being so important in developing connected services and sharing data. How is that different with services that are delivered by a single business area? What kinds of approaches work differently in when we're developing connected services?
I think it's a really interesting space and one that we probably haven't fully cracked the nut on. And especially for something like Health Gateway, where we developed it for the public space as a public service, it doesn't follow the typical, I'm going to say, big G governance models that we might use internally within our internal structures, where, it might be more hierarchical, there's different directions set by leadership and what have you. We need to offset that with what we hear from the public and how we can provide value and meaningful impact to what their needs are. And that if we're hearing from them directly that they would like us to add a new feature or a capability, or how can we improve X or Y, we need to be able to consume that and be able to provide feedback on when we're going to advance that, why we can't, in a way that resonates with them, but also play that back internally to leadership tables and other internal government and partner tables to say, this is where our priorities come from. We need to have a blended governance model. It's not just one particular group or area, because ultimately nobody really owns the public or the patients. And so I think that's the real shift in dynamics.
Mm-hmm. So some governance focused around having the voice of the people in British Columbia at the table somehow,
At the table.
and then bringing together how each of us can support that.
Yeah. Yeah, direct engagement, I would say. I think it's an area that in some cases we do really well, but in some cases, I think we sometimes are also a little bit fearful. And we shouldn't be. And we should be welcome to the feedback and the comments we get so that we can learn from them.
Yeah, absolutely. Okay, so we're getting our first question from the audience. Do you have any tips for engaging with leadership when trying to promote or develop connected services? Maybe Kaine will ask you this.
Sure. It's a tough one because I think, like Pam mentioned, everything's so unique in their space, and yours is going to be different than mine, and mine's going to be different than Pam's, depending what initiative you're leading. But there are some like learned lessons, and it really goes back to the first piece that we both spoke about, is engaging early. So if there's something you need buy-in from, really having those discussions before you've even started and including them and the right people in the right room in that space. And also, depending what you're pushing for, like in our world, we're lucky to live in an agile Scrum methodology, and it took a lot of work to get senior executive in that as well. That took like a year. So I wouldn't, even if you do it the right way, you're still going to have some time to put in to actually bring them along the journey, unless you get blessed with somebody who's been in that space before.
Mm-hmm. Yeah, and I think as you're looking at the agile space and the continuous communication, one of the things that is often powerful is to provide those voices. So if you're doing user experience research, you're working with the users and bringing those sort of quotes verbatim to those sessions, because I've seen that be really powerful. Pam, is there anything you'd add to that?
I would say that's really such an important part, the real lived experiences, and weaving that into whatever communications, presentations, whatever works with leadership and executives. So being really clear about the problem space and using those real examples to say, here's the current example, here's a proposed visionary future state that we're trying to get to, and the outcomes that collectively we'll be able to achieve and the value it will have, and telling the story that way. And recognizing, yes, there's technology components, there's policy components and what have you, but not leading with that. Those are all the enablers and the supports. It's really telling the story of here's how we're going to make things better and improve, and the outcome it will help us achieve.
Mm-hmm. I really like that, defining the problem space and making it pretty crisp, right? Like you can go down quite a few rabbit holes with problem space and really making it clear how we can make things better. In what the problems are now, and the risks of not doing something, I think, is also something that we learned during the pandemic, when it was very clear the risk of not doing something is much higher than the risk of doing something maybe not correctly that first time. So that's I think that's something that we learned there. All right. Their thoughts on getting leadership involved from other groups. So as we work with partners, have you found it helpful to sort of set the ground with folks that at the working level, and then have them carry the message to their leadership? Or have you found it works better at a leadership to leadership level when you're trying to get these things off the ground?
You can go first if you want.
Yeah, sure, Kaine. Yeah.
Sure, yeah. And again, just going to keep saying the same thing. It's going to be different in those spaces. So I have the multiple projects. The one we would use the leadership to leadership level. So meaning that you have like the directors, and you have a working group even under the directors. They're touching base in a biweekly kind of cadence in that space. But then when you get something to heavier political sensitivity, like probably the stuff Pam lives. Luckily, I don't have a lot of that, but the recent one for us would be beneficial ownership, that involves multiple ministries, so Ministry of Finance and then other interested parties. That one for sure is like, it's an easy, yes, you go to the top level and you create like an ADM governance or like a high level governance to support the initiatives, as well as the below levels in that. So it really depends on the level of complexity and political sensitivity I think your project has in that space, but gives you options.
How about you, Pam? How's it been when you're working with other organizations?
Completely agreed. Like there's two paths. There's one where it depends on the initiative, and where we use both, where we have the local levels, the local team also messaging up, but then it's supported by leadership, other stakeholders, and then where there's cross-government partnerships, it's really calling in on those relationships and making sure all that leadership is getting the same message. So they're hearing it from their team. They're also hearing it from maybe the ministry that is leading the work, saying this is where things are going well, this is where things are not going well. And it's just over communicate. Be persistent and over communicate. Don't feel defeated. Don't give up. It does take time, but the beauty is when you have senior leadership from across government, they support each other really well, even if they're at different places in their exposure to digital or agile or whatever it may be. And so they help each other along too. And our job is really to make sure they're getting the right information that they need to be able to have those conversations.
That's really good to hear, that community is so helpful to each other. That's great. So a question, I think, coming off of some of the things that you were saying, Kaine, why is it so hard to convince senior leadership that an agile service design approach, along with continuous delivery, is a better way to deliver connected services? So a question from the audience around that. Oh, you're muted.
Thanks. Sorry, I was just laughing a little bit because that's a really tough question for that space. But to start off, like I think for government, obviously within the lab being born from CJ and like all these great initiatives that kind of pushed us along, like it's only been 5 years, I think, in that space, right? That's pretty infantile for us. And luckily, like for me, I feel really lucky that I've been involved in that 5 years. So I've been able to live that and see the benefits like in a daily piece. And then I have my executive and my leadership who's seen it over that period of time. So yeah, I think it's just giving the people who haven't been involved in that on a daily space for 5 years, some just kind of what Pam said, you have to take a step back and see what they need and help them get there. And it's going to take time.
That's great. And I think the examples that you set are really helpful as well for other people. So definitely applaud the living the public service value of courage in that space. Okay, we have a question as well from the audience. So maybe I'll start with Pam on this one. What's one of the most common types of barriers or challenges that you encounter?
Oh, that's a good one. It's I'm going to say continued support, if I had to be honest, because this isn't a one and done thing. Like we said earlier, we're providing a service to the public. We have a commitment and an obligation to keep our services up and running. And I think that's often, if you look at our infrastructure, where we don't do that, and it's a parallel example. So I would say that's the biggest challenge, and that continued commitment and ongoing support that we're doing the right things, we're having the right impact. This is an investment that we need to continue in, and I must say a smaller investment than some when you look at how we do delivery or how we've done delivery in the past. And that kind of ties into the last question on why it can be so challenging for leadership to recognize agile or what have you. I think it's less about the methodology and it's about the long memories and our delivery track record, if I can say. But I also want to say in the past 5 years, we've done amazing things as government, and we've proven that we can deliver as government. So I'm hoping, it's that recognition of that continued commitment of the work we do and who we're doing it for.
That's great. Yeah, I think that sustainment is a really good point. In government, we tend to have new priorities come at us fairly frequently. So it's great to have a strategy on how we sustain the momentum over time. there's often more attention at the outset than there would be, 2 or 3 years on. So how do we keep that sustained? That's a really good point. All right. Great. So I guess ask a general question around what does connected services mean to you, Kaine?
Thanks, Genevieve. And I think it can mean a whole bunch of things, but like my discussion around data access. So really the way I look at it, that space is that we have community partners, community services, and then other entrepreneurs and businesses that actually support the work registries or Service BC does already, and leveraging those groups in a connected service to make a client's experience better and more seamless. There's that one aspect that I was focusing on in this chat. There's the other ones where it's like end-to-end government service that you can focus on as well. Pam kind of talked a little bit about that. So for me in that space, it would be working with our partners like the ministries that use our services, but also the banks and the private sector, and allowing them to use our data and make services that are actually even better and more nimble potentially than we can offer. Like we're offering that baseline service. So allowing that really created for registries like a nice stream and end-to-end service for multiple parties.
That's great. So that user experience of folks seeing a holistic problem being solved that can be supported by government working together, as well as government working with our partners in broader public sector, and our partners in the private sector, really focused on the actual need that's being solved. That's great. Another question for Pam. What kinds of measures of success do you use for these types of services?
That's a really good one. There's a few, like we look at some of the tangible ones, like how many Health Gateway users have registered, what are the return trip visits look like, for what purpose, things like that. But we also monitor it based on the kind of feedback we get from people. Did it improve it? Was it neutral? Did it make it worse? All those things, because that's where we're really getting our measures from in terms of, are we improving access to information? And we're just one tip of the iceberg. So that's really, really the key, I would say, feedback from the public, their families, from our health sector community on how we're stitching together health information and services across the province.
Mm-hmm. And is that part of how we sustain the focus on these types of things, is to communicate out those measures? Or
I think communicating measures has value to certain audiences, but is not necessarily applicable to all audiences or relevant. So that's where it comes back to, what's the impact we're having. I think the other piece is where we're also using other digital supports like our BC Services card. It's also promotion of those kind of assets and saying, this is an asset in BC that we use under this purpose, and this is why it serves value and why we have to go this route. So I think those are some of the other, again, tactical measures, but it really comes back out to, what's the impact we're having in the digital space? And then how do we also not lose sight of the non-digital space as well? And I don't want to leave this without mentioning that we can do amazing things in the digital space, but we have to make sure that we have this equivalent supports of some kind for those folks that aren't fully ready for digital or don't have access to digital. And it's like, so how do we make sure that we're not disempowering them, that they're still, through community supports or what have you, able to get at what they need?
Absolutely. And we know that folks use more than one means, even for the same service, right? They may start in a physical location and then go online. They may start on the phone and then go online and then go to a service center. In my example, I think I used all of the possible means of communicating. So I think that's something we need to keep in mind in terms of connection. It's not just across services, but also with all the different channels. Okay, well, thank you so much for your great insights that you provided today. I know your initiatives and your leadership are so inspiring to so many people, including myself. So it was so wonderful to have you on today. And thank you to the audience for providing the great questions. So we are nearing the end of the time here, and at the end of the live stream, you'll be able to access our digital plan. It's been live for several weeks now at digital.gov.bc.ca and learn more about our missions in the digital plan. And you will also get a short survey that will be posted in the chat, as well as you may receive it by email. And as we said earlier, the feedback is vital for shaping our future events and making sure that these stay relevant to you on an ongoing basis. So I very much look forward to seeing you at the next live stream. Thanks, everyone.